Hi all. Today we'll go through the essentials of arterial pulse examination, a fundamental component of cardiovascular assessment. The palpable pulse represents the pressure wave created by left ventricular ejection, and when assessing it, you must evaluate the rate, rhythm, volume, and character. Start at the radial pulse, placing your index and middle fingers just lateral to the flexor carpi radialis tendon. Assess the rhythm and count the pulse for 15 seconds, multiplying by 4 to obtain the beats per minute. To check for a collapsing pulse, first ensure the patient has no shoulder or arm discomfort, then feel the pulse with the base of your fingers and raise the patient's arms straight above their head. A forceful, rapidly rising and collapsing pulse may indicate conditions such as aortic regurgitation. Compare both radial pulses simultaneously to detect any radio-radial delay which may suggest arterial obstruction or subclavian disease. Next, palpate the brachial pulse by cupping the patient's elbow and placing your thumb medial to the biceps tendon in the antecubital fossa. This artery is useful for assessing the pulse volume and character, especially when the radial pulse is weak. For the carotid pulse, always explain the maneuver first. With the patient semi-recumbent, place your fingertips between the larynx and the anterior border of the sternocleidomastoid muscle. Palpate gently, as firm pressure can trigger a vagal reflex, and never assess both carotids at the same time. After palpation, listen over each carotid artery for bruits using the diaphragm of your stethoscope while the patient holds their breath in inspiration. Bruits suggest turbulent flow due to atherosclerotic stenosis. By systematically assessing the rate, rhythm, volume and waveform across the radial, brachial and carotid arteries, you gain vital information about arrhythmias, valvular disease, aortic pathology, peripheral vascular obstruction and overall cardiovascular status. Thank you.